Director of Clinical Excellence here at Phamily. High blood pressure or hypertension is one of the most common chronic conditions that we're seeing in primary care. It's also one of the most dangerous when left unmanaged. This can increase the risk of heart disease, stroke, and even kidney problems. But as many healthcare professionals know, managing hypertension takes more than just prescribing medication during an office visit. It requires ongoing support, behavioral changes, and often overcoming barriers that patients are facing in their daily lives. Today, I want to share how proactive between-visit care can transform hypertension management and improve patient outcomes. So nearly 1 billion people worldwide are actually affected by hypertension. It's a major risk factor for complications such as heart disease, stroke, kidney disease, and even vision loss. One of the big ones is that symptoms are not very noticeable at first, and patients may actually be iller than they currently feel. And this can lead to patients not taking their hypertension seriously until things get much worse. In addition, monitoring can be challenging. Patients may not have access to the right tools for blood pressure devices at home, or even understanding how to interpret their readings if they do have access to those devices. Medication adherence is a big one as well. Patients may have struggles with remembering to take their medications, financial issues acquiring those medications, and even taking them on time. Lifestyle factors also play a large role here. Access to nutritious food, food literacy, understanding the impact that diet, smoking, and even physical inactivity play as well. Like we spoke about earlier, the biggest issue here is that when hypertension is poorly managed, it can lead to multi-organ complications like heart disease, kidney disease, stroke, cognitive decline, and vision loss. Managing hypertension effectively in office visits is complicated. One of the major reasons behind that is because office visits are short and often hard to come by for patients. Effective management is multi-step here, and that's hard to accomplish during a short visit. So multi-step management means that we're not just looking at the patient's blood pressure numbers, we're also trying to understand exterior factors that can be contributing to their blood pressure and hypertension. There are lots of ways that care management can help improve blood pressure control. One, we can work on medication adherence and identifying whether patients are actually having issues taking their medications and making adjustments in the moment, keeping them on track. It's also a great way to provide lifestyle coaching, such as management for their exercise plans or nutritional support, and providing a lot of in-the-moment patient education and strategies. The biggest one would be patients' comorbidities. A lot of people with hypertension are also dealing with kidney disease, diabetes, amongst other chronic conditions. In addition to that, that means that medication-related issues could come up, whether patients are adhering to their medication schedules, are they missing doses, are they having issues picking up those medications at the pharmacy, understanding what lifestyle factors are impacting them at home, as well as whether they have access to the resources that they need to manage their care. Patients having access, such as understanding health literacy, having the appropriate follow-up appointments, whether they're scheduled or referrals that are being made, or limited monitoring access at home for devices and understanding how to read those numbers. So I think helping patients identify a small change or specific action and then regularly checking in with them remotely is a great, small but effective strategy that practices can use to support their patients in between visits. Another strategy that practices can adopt is making it easier for patients to follow up with their care teams without requiring an office visit. This is a great tool to be used when you're handling day-to-day questions, patient education, or adherence. If there's one key takeaway for healthcare professionals while managing hypertension, it would be that small sustained efforts can actually make a big difference in preventing life-threatening complications. Controlling hypertension isn't just about numbers on a chart. It's about empowering patients to take charge of their health with the right tools and support. When care teams stay connected with patients between visits, monitoring progress, coaching lifestyle changes, and addressing challenges early, we can prevent complications and help patients lead healthier lives.